Good afternoon. This is a recorded lecture on leukocyte cytochemistry. Right, so leukocyte cytochemistry are techniques that we use to identify the presence of enzymes or other substances in the cytoplasm of hemopoietic cells. So primarily the WBCs, the precursors of WBCs. We use these techniques to characterize the immature cells in the different types of leukemias, particularly acute myeloid leukemias, and to identify abnormalities in the maturation of those cells in the myeloproliferative disorders. We don't normally use this technique to identify lymphoproliferative disorders because most of the time it's done by immunologic techniques. Right, so most of the time the tests that we do in cytochemical testing is compared with H&E, Romanowski stains, and other immunologic techniques. The specimen we use are blood and marrow smears, okay, which are stained. And aside from what we have mentioned, these are the details of use of cytochemistry. Okay, to characterize the blood cells, we already mentioned that to identify the components of certain types of cells in myeloid anemia. Okay, to identify abnormalities in the clonal myeloid disorders, for example, basophils and mast cells, and to identify cytoplasmic abnormalities and enzyme deficiencies in this kind of disease or disorder. MPO, this is the first enzyme, one of the enzymes that we can use to uh, characterize the cells in the bone marrow in the blood. Okay, this is found in the granules of granulocytes and their precursors, in the eosinophils, in the eosinophil granules of the monocytes. In order to compare, to identify the difference between the one that is found in the eosinophil granules and that which is found in neutrophil and monocyte granules, we can use cyanide. So cyanide can differentiate between these two forms of peroxidase, myeloperoxidase. The principle involved in this reaction is that this enzyme can cleave H2O2 hydrogen peroxide, and the product can form an insoluble chromogenic substance. Okay, for example, in this case, 3,3-diaminobenzidine or the AB, right? So the product is stable, insoluble, and non-diffusible, and we can measure this. Not measure, but we can detect this in the slide. What will be the appearance? What will be the appearance of this colored substance? It will result in brown or granular staining on the cytoplasm. Red cells and erythroid precursors will show diffuse brown cytoplasmic staining. Later we can see that. The most primitive myeloblasts are negative, with granularly positively appearing progressively as they mature towards the promyelocyte stage. So slowly they become positive. And promyelocyte and myelocyte are the most strongly staining cells in this series. Metamyelocytes and neutrophils have fewer positive granules, and eosinophil granules are strongly and large, and it's easy to distinguish from neutrophil granules because neutrophil granules are much more smaller. The monoblasts and the monocytes may be negative or positive, so there is a variable result. And in basophil granules, it is not possible to demonstrate in this using this reaction. This is the appearance of this technique, MPO technique, as we said, this is brown, and as you can see, the red blood cells are stained brown, while the cells, the cells are deposited usually on the sides of the cytoplasm. So this is a case of acute myeloid leukemia. Another stain, another substance that we can use to differentiate the different cells is Sudan block B. So this is a stain that is used to bind with the lipids, and this can irreversibly bind to certain components in the granules of the granulocytes, eosinophil, and some monocytes. It can be extracted from the stained granules by organic dye solvents, cannot be extracted, and give comparable information comparable to that of the first stain, MPO. The color would be black, and there will be granular deposits in the cytoplasm. So what we can see in myeloperoxidase stain is similar to that of Sudan block B. Later on, we will see the only difference in the staining. So MPO negative neutrophils are also negative. The only notable difference is when eosinophil granules are stained, they will have a clear core. That means the center would be clear. Basophils are not positive, but what we can see in the basophils would be red, purple, metachromatic staining of the granules. Right, so this is the appearance of a blood smear that was stained using Sudan block B. So it's not exactly black, but more like grayish in color for the red blood cells, and you can see that in the cytoplasm there are deposits, granular deposits, and you can see those rod-like structures. They are our rods. Okay, and it's possible to do another staining technique, as we have been told. This is not exclusively used for this method only. We have to compare it with stains, the other stains, the staining techniques. Another one is neutrophil alkaline phosphatase. Right, so this is used in the identification of alkaline phosphatase activity in mature neutrophils and some in metamyelocytes. Right, so although this will demonstrate also granular reaction in the cytoplasm, there will also be intracytoplasmic membranous components that is distinct from the primary or secondary granules. So aside from the granules themselves being stained, it will also stain other substances within the cytoplasm. Other leukocytes are negative, but in some cases, like in lymphoid malignancies, they can show some activities. The bone marrow macrophages are positive, and if we use another technique in combination with azo dyes, it will give a better result. So in this case, the substrate that is used with the enzyme is naphthol. And this naphthol will liberate naphthol rather than phosphate. So the resulting chemical substance is phosphate, and phosphate will be rather, if naphthol can be allowed to combine with a dye, that will provide us with a coloration in the slide. Interpretation of results. So the appearance or the color of the cells in the granules in the cytoplasm would be blue. Neutrophils can have a variable result, negative to strongly positive, with coarse granules. So we can also do scoring. There is a scoring for use for the identification of these neutrophils. So we use these scoring techniques: negative if there are no granules present, occasional granules, that is 1, moderate granules, that is 2, numerous granules 3, and then heavy granules would be 4. The maximum score would be 400, and the minimum is 0 when you don't see any granules in the neutrophils. So you need to count in In normal individuals, the neutrophils with score of 3 and 4 should not be present. Okay, in physiologic conditions like, for example, in babies, newborn babies, in children and pregnant women, you might find that the score is high, and premenopausal women would have higher, about one-third higher than in men. In pathological states like, for example, in chronic myeloid leukemia, you will find that the chronic stage would have 0. Okay, but transient rises may happen during the infection with intercurrent infection, if there is infection happening. In myeloid blast transformation, the score slowly rises. There are also some conditions, for example, paroxysmal nocturnal hemoglobinuria. They will encounter low scores, and that is also true for hereditary hypophosphatasia. So there are reasons for increased NAP scores are the following: neutrophilia because of infection, bacterial infection, polycythemia rubra vera. Okay, so that is erythrocytosis, leukocyte reaction. So that is when the WBCs are also elevated for no specific reason. Hodgkin's disease, which is the lymphoproliferative disorder. Okay, in aplastic anemia, when the bone marrow is no longer producing the blood cells, the NAP score is high, but it will fall if there will be paroxysmal nocturnal hemoglobinuria. So we can see here the scoring we have for the neutrophil. So those are the neutrophils, 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 neutrophils. Okay, you can see here that there are no granules, so the score is 0. Okay, and then what else? Here, there are slightly some granules, and then it slowly becomes more and more, okay, in the following slide. So this is 1, score of 1, score of 2 for this one, and score of 3 for those two. Okay, is that? So 2 neutrophils with a score of 2, because this is more or less comparable in color, and this one is darker, so maybe this is 3. So it's and then finally we have 2 neutrophils with score of 4, very dark, and 1 with a score of 2. So this is more or less comparable with this color. So this is plus 2 or 2 in scoring. Right, another technique, another cytochemical method is acid-phosphatase reaction. Right, so this is found in almost all cells, so ubiquitous, that means universally found. And then the staining intensity also varies depending on the method that is employed. Right, so the color that you may see is also variable depending on the method that is used. So this is used for the identification of acute leukemias and hairy cell leukemia. So far this is the only situation that we mentioned of condition affecting the lymphocytic series. Okay, so there is what we call para-rosanilin method. So this is a dye that is usually colorless, but it can be used to demonstrate the presence of this enzyme in the lymphoid cells. Right, so what do we expect to see? There will be a mixture of red granules with diffuse positivity. In T cells, there is an early differentiation feature. Okay, so acid phosphate may show early differentiation in features. Um, all acute and chronic T leukemia show strong activity. T cell acute leukemia is highly localized or polar. Granulocytes are strongly positive, and other cells, monocytes, eosinophil platelets show variable positivity, so they may have a strong or weak positivity. In the bone marrow, the macrophages, okay, plasma cells and megakaryocytes are strongly positive. So this is what we expect to see when we use acid phosphatase as a stain. Right, so this is the result. So you see the red granules usually in the side of the cytoplasm. So those cells that we see here are blast cells of T lineage, okay, T lineage cells. Another one is periodic acid-schiff reaction. So this periodic acid-schiff reaction is particular to carbohydrate molecules. Carbohydrate molecules, right? So they give a red reaction, okay, when they are exposed to Schiff's reagent, okay, also known as leucobasic fuchsin, okay, and then, right, so as I mentioned, this is possible to detect in as long as there is the presence of carbohydrates like monosaccharides, polysaccharides, glycoproteins, mucoproteins, sugars, phosphorylated sugars, inositols, and cerebrosides. Right, so if you want to distinguish it between glycogen, like in glycogen storage diseases, okay, you can use diastase, okay, another enzyme. So the main positive reaction in hemopoietic cells is because of glycogen. So the color, we expect the color to be red. It may vary depending on the intensity of the color from pink to bright red. Okay, cytoplasmic positivity may be diffuse or granular. So diffuse, that means that you cannot really see the granules. And then when it's granular, of course, there is visible spots in the cytoplasm. The precursor of granulocytes show weak positive reaction, and neutrophils may show intense granular positivity. So that is just to compare the two groups of cells. Eosinophil granules are negative with diffuse cytoplasmic positivity, and basophils may be negative. Monocytes and their precursor, there is a variable diffuse positivity with superimposed fine granules. Okay, for the precursors of the RBC, they are negative, and for megakaryocytes and platelets, variable result. Right, so about 10 to 40% of the lymphocytes show granular positivity with negative background in the cytoplasm. Right, so let us look at this blood film. We can see the pinkish appearance, so showing the positive result in the blast cells. Okay, so this is a case of acute lymphoblastic anemia, leukemia. Right, so another one here is the esterases, leukocyte esterase. They are enzymes that hydrolyze acyl or chloroacyl esters of alpha-naphthol or naphtholase. Okay, so there are two types. We have the specific and the non-specific esterase. So this specific esterase is found in the granulocytes, and they stain this naphtholase dichloroacetate esterase, or simply CAE chloroacetate esterase. The other one, NSE or non-specific esterase, stains alpha naphthyl acetate or a esterase, and it's also called ANAE, and alpha naphthyl butyrate esterase, or simply butyrate esterase, BE. Right, so those are the substrates and the enzyme that referred to as leukocyte esterase. The color is bright red. The reaction is bright red. This is mainly used to identify cells of the granulocyte series and the mast cells. The activity in the cytoplasm, this chloroacetate esterase, appears only as myoblasts mature to become promyelocyte. So the positivity in myeloblasts is rare, but in promyelocytes and myelocyte, it becomes stronger. Right, so the more mature granulocytes stain strongly but less intensely. Okay, it is therefore useful as a marker of granulocytic leukemias. So the so-called myelocytic leukemias. So you know that there are 7 classifications. So one of those leukemias. Right, so this is a leukemic blast cell. So you can see here the large cells that are stained with chloroacetate esterase. Okay, the dye that is used is called Corinth V, and this is a case of acute myeloid leukemia, M2 category. Acute promyelocytic leukemia shows cells are heavily stained. The cytoplasm is heavily stained, and they may have multiple hour rods, okay, with a hollow core. It is rare to see CAE positive hour rods in other forms of AML, so that is possible to identify this acute promyelocytic leukemia because of this finding. Okay, result with alpha-noftilbutyrate esterase. So this is the non-specific esterase. There is brown product in the cytoplasm and also granular. So you would notice that in all staining techniques, it can either be diffuse or granular. So that is the only choice that we have to describe the stains on the cytoplasm. Majority of the monocytes, more than 80%, stain strongly, and so of course the remaining would be weak. Majority of the monocytes, okay, that is already repeated. Next, neutrophils, eosinophils, basophils, and platelets are negative. The B lymphocytes are negative. T lymphocytes are not really reliably stained. If you check the bone marrow, monocytes and their precursors and macrophages stain strongly using these non-specific stains because this is more specific to identify monocytic component in AML rather than CAE, okay, or the specific monocyte. So this is better to use in identifying monocytic substances or cell precursors. Results, if you use the other esterase, alpha-naphthyl acetate, so that is a specific esterase. So we expect to see diffuse instead of granular. The color is red or brown in color, and normal and leukemic monocytes stain strongly. Normal granulocytes are negative, but in certain conditions like in myelodysplasia or AML, you may encounter some positive reactions. Right, so in this stain, you can see the presence of um, those they are actually granular structures on the surface of the cytoplasm. So this is ANAE, non-specific staining, so diffuse, okay, I mean present in the cytoplasm. This is M5 category, acute myeloid leukemia. What about megakaryocytes? Megakaryocytes are strongly stained. Leukemic megakaryoblast may show focal or diffuse positivity. T lymphocytes, T lymphoblasts show dot-like positivity, and immunophenotyping superseded this cytochemistry. So therefore, it is better to utilize immunologic techniques for this for the identification of the T cells. Leukemic erythroblasts may show focal or diffuse positivity. When they say focal, that means it is concentrated in one part of the cell. When they say diffuse, it's like not concentrated, so it's located in various parts of the cell. How do you interpret when you use ANAE or CAE? So the ANAE will give a brown product reaction, and CAE granular bright blue product. So this is just a comparison if you use these two different esterases. staining patterns are identical with two stains that were used separately. Okay, so let us look at this example. So using a specific esterase, you can see the presence of, it's almost like reddish, but it's brownish color brownish in color, reddish brown in color, excuse me. So that is for the granulocytes. Those are granulocytes, those that are colored. So the others are monocytes. 5 cells in the pictures are monocytes rather. 5 cells are monocytes, and you can see that in some cells there are bluish granular deposits. So that is for the CAE. Okay, this is non-specific, and that one is specific, the blue ones. Double staining technique avoids the need to compare the result, so it will be possible by combining the two esterases. We can identify readily the different cells that are present. As what do you think is the reason why we need to do this staining? So as we have mentioned, it's really difficult to identify the different cells because they are not really normal. Even experienced pathologists would have difficulty in identifying them. So by using stains, it will be possible to identify the myelocytic series and even the other hematopoietic cells. So in myelomonocytic leukemia, cells are stained with both esterases. Okay, in myelodysplasia and AML, acute myeloid leukemia, and with dysplastic granulocyte, okay, double staining of cells may be present. So you will find both the brown and the blue granules. So for these two different conditions. So interpretation of result with single incubation of double esterase. The product is bright blue for granulocytes, okay, and it's dark green or brown for monocytes, A and B, non-specific. Okay, does not stain the megakaryocytes, and T cells are strongly stained as the alpha-naphthyl acetate. In acute myeloid leukemia, the stain is able to identify the monocytic and the granulocytic components because of this ability to color them differently. Okay, another one is toluidine stain. So toluidine blue is the stain that we use here, and this is used to enumerate or identify basophils and mast cells because the stain has a strong binding affinity to the granules of those cells. Right, so it sometimes is difficult to identify those granules of the neutrophil using the normal Romanovsky stain like H&E staining. Right, so this is the result of staining using a toluidine blue stain. But in this case, what we can see are simply lymphocytes that demonstrate metachromatic staining. So different colors inside the lymphocytes. But of course, we expect this to be positive for basophils and for mast cells. Right, so in AML and CML, chronic and acute myeloid leukemia and other disorders, the basophils may be dysplastic and poorly granular, so it would be difficult to identify them. So that is the reason why it's better to use Loluidine blue to identify those cells, because by relying only on their morphology, it would be difficult to say that, okay, this is a basophil or a mast cell, right? So result, the granules of basophils and mast cells are stained bright red or purple. They are discrete and distinct. Nuclei stain blue, and cells with abundant RNA may show blue tint. So that is why there is a like polychromasia or metachromasia Although toluidine blue is said to be specific for these granules, if you increase the incubation, even the primary granules of the promyelocyte may also stain red or purple. So in order to avoid that problem, therefore, we have to make sure that we limit the incubation period to less than 10 minutes. So the only differentiating characteristic is that the granules, of course, the granules of the promyelocytes are usually smaller and finer. As we know, mast cells and basophils have large granules. Right, so that would conclude the presentation for this session. I hope you understand the topic. For the activity, which can be submitted as an assignment, you can make a table summarizing the result using those different stains. But like this, it's like this. It's similar to this one, except that you will be using a terms. For example, you will use color. What is the color for peroxidase? What is the color of the cytoplasm? Okay, for the erythrocytes, for the neutrophil, or the different types of cells. You can add here the myelocytic series, like the promyelocyte and all of them. Okay, and all of these. So description rather than color. So it's more like this one.